The call to test newborns for rare but treatable diseases is growing tonight, but the process for approving those tests is long and cumbersome. Fox 6 investigator Brian Polson shows you how a bureaucratic marathon could result in fatal delays.
By the time Gwendolyn Clubb was born,
she's number 6.
Her parents had 5 other healthy children.
Good job, way that belly.
So the big family from the tiny village of Millador was not prepared for the call.
And we're like, you must have the wrong person.
That Gwen had Pompe disease.
I don't know what the heck that is, so you Google it, right? So you Google it, I couldn't make it past the first paragraph.
Pompe is a genetic disorder that robs cells of the ability to recycle complex sugars. The resulting buildup of waste causes weak muscles, labored breathing, and eventually heart failure.
Called and, told to go home and love our baby.
For the most severely affected infants, it can be a death sentence.
It was devastating to think that she wasn't going to make it till 2. Devastating.
In the summer of 2017, the state of Wisconsin started testing all newborns for Pompe as part of a pilot study. Over a 2-year period, they screened more than 108,000 children. 13 tested positive.
Be careful.
Including Gwen.
We're so blessed to know and to be able to monitor her.
You're a good climber.
Fortunately, hers is a less severe form of the disease that may not surface for years. And because she was tested at birth, her parents now know to watch for symptoms so they can immediately start enzyme replacement therapy.
A treatment to have them be healthy as long as possible. Okay, can we push back up?
Not every child with Pompe
Push. Push. You can do it.
has been so lucky.
Look at you.
Atlas Foucher was born in Oshkosh in 2016,
Okay, meet you at your table.
before the state's Pompe study began.
That early identification makes such a world of difference.
At 3 months old, his heart began to fail, and he was rushed to Children's Hospital of Wisconsin.
It was a very scary time.
Only then did doctors discover Pompe disease had nearly killed him.
The fact that he had to wait to be so symptomatic did have a very detrimental effect on him. What do you think?
Genevieve is grateful for the enzyme treatments that are keeping her son alive,
Yeah. Her motorcycle?
but fully aware newborn screening could have made his life much easier.
Ultimately, damage that's done is damage that's done, and there's no reversing that.
5-year-old Atlas
His quality of life could have totally been the opposite.
and 3-year-old Gwen
This is kind of stuff.
are living proof.
The early identification is that make a difference.
Dr. May Baker is co-director of Wisconsin's Newborn Screening Laboratory, which takes blood cards collected at the hospital and screens them for nearly 50 disorders from cystic fibrosis to sickle cell anemia.
And I think the beauty of a newborn screening is really the prevention emphasized. And this is a future medicine to go from reactive to proactive to prevent disease.
She says Pompe is the perfect example of the type of disorder they should be testing for. There's just one problem. The state stopped testing for Pompe when the pilot study ended in 2019.
Okay, we need to do something about it.
So Stephanie and Michael Clubb nominated Pompe for permanent inclusion in the newborn screening program. They even secured the support of the Department of Health Services and Governor Evers. But 2 years later, their proposal is still winding its way through the state's long and convoluted rulemaking process.
We're kind of stuck on the back burner.
A life-saving test buried in red tape.
Like, okay, when is this going to come, to help other families?
This process was definitely eye-opening.
We've tried going through the normal process.
State Senator Patrick Teston says he tried to follow that same process for another genetic disorder known as Krabbe disease.
Unfortunately, that process has failed.
Like Pompe, Krabbe is fatal in its most severe form if not detected early. And according to Dr. Baker, the two diseases are so similar, if they start testing for one, they could test for the other for free.
Adding on one disorder would not have additional cost.
So basically, we're getting a 2-for-1 deal here.
In June, he introduced legislation that would link Krabbe and Pompe testing together.
That can piggyback onto what we're doing.
It's an idea the clubs wholeheartedly support.
Power in numbers, absolutely.
They now have 7 children, and because of Gwen's diagnosis, they decided to test them all. 3 have Pompe.
7 beautiful kids, and what are the chances?
You want to pump your legs?
But Stephanie says newborn screening is no longer about them.
It's so much bigger than us and our family.
After all, when lives are at stake, there's no time for red tape. Brian Polson, Fox 6 Investigators.
The Wisconsin Department of Health Services declining a request for an on-camera interview, but in written answers to a series of questions from Brian, the department says every effort is being made to begin universal statewide screening for Pompe disease as soon as possible. However, the department cannot estimate how long that will take. And you can read our full Q&A with the Division of Public Health at fox6now.com. As for Krabbe disease, DHS says it still needs more information. A public hearing on Senator Teston's bill is scheduled for this Thursday in Madison.